Thank you for allowing me to speak to you. I am Dr. David Wata. I am a clinical pharmacist working at the Kenyatta National Hospital. This day, I would like to discuss on conventional anti-cancer chemotherapy side effects. So we'll go ahead and classify the conventional anti-cancer chemotherapy drugs. So we group them into 5 broad groups, and then we subclassify them into subclasses. So the 5 broad groups are 1, alkylating agents, antimetabolites, natural products, antibiotics, and what we refer to as miscellaneous. The alkylating agents, we subclassify them into nitrogen mustards, alkyl sulfonates, nitrosoureas, methylene imines, triazines, and methylhydrazines. Antimetabolites, we classify them into antifolates, antipyrimidines, and antipurines. The natural products, these are products derived from plants or semi-synthetic products from plants. These include the vinca alkaloids, epipodophyllitoxins, taxanes, and the camptothecins. The next group are the anti-cancer antibiotics. These are derived from microorganisms. They are the anthracyclines, actinomycins, and bleomycins. Then miscellaneous, you're not able to neatly classify them into another group, and so we just classify them as miscellaneous. And this will include the platinum agents, enzymes, steroids, retinoids, and others. So you can see from this slide just how some of these drugs look like in terms of their chemistry. So you can see on your right, there's the cyclophosphamide. Then you can see some of the antimetabolites like methotrexate and 5-fluorouracil. You can see how complex the vincristine is. And also the actinomycin. Bleomycin is also a complex compound. Now, in the next slide, we shall look at some of the examples of these drugs. Beginning with nitrogen mustards from the alkylating agents. So the examples are cyclophosphamide, ifosfamide, chlorambucil, melphalan, and mastine. Mastine is the oldest alkylating agent to have been discovered. And then bisulfan in alkyl sulfonates, procarbazine and methylhydrazines, temozolomide and dacarbazine in triazines, and lomustine in nitrosoureas. For the folic antagonist, there's the methotrexate and pemetrexate. Purine antagonist, there's the 6-mercaptopurine, fludarabine, and nelarabine. The pyrimidine antagonists, we have the 5-fluorouracil, gemcitabine, and cytarabine. Vinca alkaloid examples are vincristine, vinblastine, and vinorelbine. The camptothecins examples are irinotecan and topotecan. Epipodophyllitoxins, the examples are etoposide and teniposide. Taxanes, the examples are paclitaxel and docetaxel. Anthracyclines, the examples are doxorubicin and daunorubicin. Then platinums, cisplatin, carboplatin, oxaliplatin. Steroids include dexamethasone and prednisolone. For bleomycins and actinomycins, the examples are just the drug. So yeah, so for bleomycins, the example is bleomycin. There's A1 and A2, and so the drug comes as a mixture of both. So we look at the general side effects. So these are side effects due to the inherent nature of the antineoplastics to destroy the rapidly proliferating cells. So these are side effects related to the cellular destructive nature of the antineoplastics. The first one being bone marrow suppression, so manifests as neutropenia, which is the most common, followed by anemia and then thrombocytopenia. Nausea and vomiting due to the destruction of the enterochromaffin cells, which release 5-HT3. The other is reproductive toxicity. So these drugs can cause, one, congenital malformations in a growing fetus if a woman is pregnant. They can cause fetal death, and they can greatly diminish the reproductive capacity of both the male and the female who are receiving these medicines. So they will affect reproduction. Then alopecia. So these are the general side effects of anti-cancer chemotherapy drugs. We can look at some of the specific side effects. And so these ones are many, but I'll just go according to this list, beginning with anthracyclines. So the main side effect of anthracyclines is cardiotoxicity. They can cause dilated cardiomyopathy, leading to heart failure. This is normally cumulative, depending on the cumulative dose of the drug. Methotrexate, high-dose methotrexate can cause mucositis. Capecitabine and 5-fluorouracil can cause hand and foot syndrome. Irinotecan is notorious for diarrhea. Cisplatin can cause nephrotoxicity, electrolyte wasting, and ototoxicity. Bleomycin can cause lung fibrosis. L-asparaginase can cause hyperglycemia, can also cause hypersensitivity reactions. Other drugs that can cause hypersensitivity reactions include etoposide and the taxanes. Just to add something on the hypersensitivity reactions, there are many other drugs that can cause, but in terms of the conventional anti-cancer chemotherapy, these are the common ones. Taxanes can also cause neuropathy. Oxaliplatin is also notorious for neuropathy, and so are zinc alkaloids. The oxazophosphorins, that is the cyclophosphamide and ifosfamide, can cause urothelial toxicity, which manifests as hemorrhagic cystitis. And so this slide just shows some of the side effects that can be caused by conventional anti-cancer chemotherapy drugs. From alopecia to conjunctivitis, ototoxicity, mucositis, cardiotoxicity, hand and foot syndrome, gonadal toxicity, neuropathy, lung fibrosis, nausea and vomiting. So the side effects are wide and varied, and they depend on the medicine. So some medicines will have more side effects compared to others. And the severity of the side effects will depend on the drug and the dosage given. So in summary, I'll pick a few points for us to take home. Bone marrow suppression is one of the most notorious, or one of the most common side effects caused by conventional anti-cancer chemotherapy. The degree of this will depend on the drug and the dose. Some drugs tend to cause more bone marrow suppression than others. What tends to happen first is neutropenia, which means the patient's immune system is affected. Then anemia follows suit second, thrombocytopenia third. So thrombocytopenia is not a common bone marrow suppression side effect, but it can happen, especially with the drugs like carboplatin. But for neutropenia, most of these drugs will cause neutropenia. If I could pick another side effect, cardiomyopathy due to anthracyclines and neuropathy due to oxaliplatin is linked to the cumulative dose. So the higher the dose, the higher the risk of, the higher the cumulative dose, the higher the risk of the patient developing this side effect. And for cardiomyopathy, we normally monitor the total cumulative dose so that we try and ensure that we minimize the risk of the patient developing this particular side effect. Hypersensitivity reactions tend to be very sporadic and unpredictable. Now, some of these adverse effects can be mitigated against using supportive care measures. So one of the important roles of the pharmacist in oncology is to mitigate for these side effects. So we'll always monitor and try to put any preventative measures to mitigate these side effects. And of course, we'll always be monitoring for the less common side effects. And in case they happen, then we also try and manage them. So the oncology pharmacist plays a major role in identification, prevention, and management of these side effects. These are my references. Thank you for listening.